some parents taking it into their own hands to say, you know what, I'm going to start a website to say,
Yeah, I saw
read
that.
all the lists, right? And so,
Hmm.
um, is it worrisome now that we're, days into the school year and we're seeing this? I mean, Quebec went back to school partly in May, and there
Hmm.
were, in the 40s, certain cases, but is this something parents need to worry about?
Well, I have to say that currently the cases that we're seeing are actually not acquired in school, right? So most of these cases have been caught either at home or because adults were doing activities without proper social distancing, whether karaoke bars or salsa dancing, there's been outbreaks there. And so I think our responsibility as parents and adults is to make sure that we comply with public health guidance so that our children can go to school safely. Um, to me, I'm not worried yet. I mean, the reason why we're um, asking children to stay home is really to make sure that there's no transmission. And so far, there hasn't been any. And yes, I understand that parents would like to have, to be notified in real time as to the fact that there is a case now in the school. But you have to realize that most of the time when you have that person and you get that person out of school, you still have 3 to 4 days before the next person becomes infectious. So you have time. What we want is that for that second person, if ever there was transmission, to not then become, in the wheel of transmission. But we have at least 48 hours to tell people to stay home. And the problem with the website is that there's no way to know if there's one case or 11. So if, let's say, 11 parents decide to say, oh, there's a case in my school, you look at the website and you could think, oh my God, that school has so many cases, but it's all just one case. And that's when it's just becomes, it gets out of hand. At this point in time, there is no outbreak in school, except for transmission that had happened between teachers. There's currently nothing that's happening with between children, and we hope to keep it that way.
It's really just, it's one person who might work or attend the school, but it wasn't like the transmission happened there, right?
Correct.
So it's a low
Absolutely.
transmission rate, you're saying, in the school itself.
Well, it's still early. What we want is to keep it that way. If you look at what happened in Europe, who has open schools before we have, what we see is, and what they report is that there's been, cases popping here and there, so that there's one case in a class and then another case in another school. But what public health has been doing is to get these people, test them, do contact tracing, and isolate the others. And that will happen throughout the school year. We need to get people to get tested. We need people to really screen for their symptoms before they go to school. To me, that's the most important thing. And we need a really rapid turnaround time for tests when they're done. If we do all that, and with public health, who's going to work, really, really hard over the next school year, what we hope for is to keep that transmission in school very low.
The idea that you were talking about, also about, knowing the results, knowing what's happening in real
Yeah.
time. For some reason, parents are, hungry for this information. Of course, they're worried. Do you think it's important? Do you think that the government has to build some sort of database like they did with the CHSLD to, say this is what's happening? And do you think that should be a basis for, let's say, one parent who says, I'm going to decide if I want to pull my kid out, knowing the real situation day to day in schools?
Yeah, so from my understanding, the regional public health offices are trying to build that data so that there's an outward facing database for people to know where there are cases and how many. At the same time, at the school level, the director will inform parents if there's a case or not. I think I use the analogy of when it started in hospitals. In March, April, May, we started to have cases in our healthcare workers, and then everybody wanted to know who was sick. And we told them is, our process is clear. If you've been in contact, we will contact you. There's no need to alert the entire hospital to say there was one case in one unit if we know that you weren't there. And we will do, a very wide nest. We're going to send a wide cast to make sure that we're not missing anyone. And that's what's going to happen. The process is there. I think we have to, for sure, ensure that it runs smoothly. Eventually, it will run more smoothly. We're just started, but the process is there so that if the people who have been in contact with that child or that teacher will have been notified directly. If you haven't heard, it's because you're not in that class. Your child wasn't, with that teacher. Um, Public health does a really good job, and I don't think we're missing that many cases when we do our contact tracing. In fact, we call more people rather than less.
Interesting. Is there, I guess, any grounds to keep your kids at home, any at all, if they don't have an underlying health condition? Those parents who are saying like, yeah, I would have had the choice to keep my kid at home had I known that there was a case in the school.
But you know what? There are cases in the school, there are cases at the supermarket, there are cases in your soccer team. I mean, we want our children to be able to do sports, to do activities. I think it's even more important for for our children to be in school. For their development, for their socialization. They need to see other children. They need to be met by their teachers directly. I mean, that's how they grow. And we want them to become good adults. And I think this is how to do this. I understand that parents are worried, but at the same time, the risk for the health of our children is small. I mean, they're not sick. It's been 10 days now, or even more so, that we haven't had any admitted child for COVID. When we look at results, we really see a little number, but really not a lot of them. They don't have a lot of complications. Even the most complicated one, recuperate pretty well. And so, yes, we want the least risk as possible for our children, but I think that there might be more risks of keeping them home than from sending them to school at this point in time, because community transmission is low. If we were like in some US cities, then yes, we would see things differently. But at this point in time, I mean, if we do what we need to do as adults, we should be able to continue to send our kids to school.
Thank you so much. I have no more questions.